Hello, today I'll be talking about Sarah Mackenzie. Now, Sarah is a 68-year-old female who was diagnosed with stage 1B breast cancer. Now, the cancer has not spread to nearby lymph nodes, nor has it caused any metastases. Sarah is a 5 years post-treatment survivor of breast cancer. Other health problems include hypertension. She was diagnosed with type 2 diabetes in 2004. She is currently obese, she has high blood glucose, and was also diagnosed with osteoporosis in 2007. Sarah was diagnosed with breast cancer in 2012 by an oncologist, where she was performing a routine mammogram and a mass was noticed. Now, the treatment that Sarah received was surgery. She did receive right lumpectomy, because it was located in her right side, and also radiation therapy. Sarah experienced the common side effects of treatment, such as fatigue, loss of appetite, nausea, weakening of the bones, and diarrhea. Sarah now complains that she is unmotivated to exercise, she has poor range of motion in her arm and shoulder, and increased fatigue. The family history of Sarah shows that her mother was diagnosed with breast cancer at the age of 58. Sarah does not have much of an exercise history. She is fairly sedentary. However, she does walk to the shopping mall 3 times a week. Now, in the initial consultation, it's important to ask a few questions just to get a better understanding of the overall medical history of the client. Now, we had asked questions regarding to complications and symptoms of post-surgery. We had also asked about side effects of experience post-surgery, whether the patient has a history of medical or mental illnesses, if she takes any hormone therapy, and if she smokes or drinks. Now, these questions, they just help give us a better understanding of what the patient is going through, as well as the chances of cancer recurrence, and it just gives us an opportunity to provide the benefits of exercise and how we could help prescribe exercise specifically to this client. So the first health professional in the team care arrangement we're going to talk about is the exercise physiologist, and their role is to help the patient regain full function as per pre-surgery. And in this case, Sarah does have a few goals that she would like help with, such as to help her with her balance. She did receive a right lumpectomy, so she is weak in her right shoulder and her right arm. Also, she does have osteoporosis, so she would like to prevent the progression of osteoporosis and build some strength in the upper limb region as well. Also, she's diabetic, and it'll be imperative for the exercise physiologist to manage her blood glucose levels just to bring her back down to normal values, and ultimately the goal is to decrease the chance of cancer recurrence. Now, psychologists also play a vital role as social support towards the clients. So psychologists can help by effectively communicating between all the allied health professionals that are involved in team care approach just for the client's benefit. So for example, the psychologist, they can refer clients to the exercise physiologist, for example, just due to the positive outcomes of physical activities, or also maybe refer them to a nutritionist because they may believe that a healthier lifestyle adaptation is needed and that the client may need educating on certain food groups. Now, furthermore, Cheetah, Hammer, Wardle, and Steeptoe in 2008 highlighted that psychological distress during and post-treatment contribute to increased risk of reoccurrence and poorer survival rates. Additionally, managing mental health symptoms can improve treatment outcomes for exercise and improve overall well-being. Now, the general practitioner has an important role in the holistic care of the patient because they do provide referrals to other allied health professionals, and that does provide support and complementary treatments, as outlined by Pivot in 2011. Now, the general practitioner does also provide regular appointments and checkups for the patient to track their progress, so that's very important. And they also do help coordinate with other health professionals just to check with the compliance of the patient and to consider any comorbidities that may come up along the way. Now, the role of the dietitian in the team care arrangement is to help identify any nutritional problems and to assess the nutritional status of the patient. Now, in particular, Mrs. Mackenzie does have a few goals that she would like to address to the dietitian, such as she does need help with lowering her blood pressure, lowering her blood glucose, and just to avoid the effects of osteoporosis. Now, the dietitian can help in that regards by basically educating the patient on what foods to eat, what foods to avoid, if there are any supplements such as calcium that she may need to take, the effects of certain foods, and what's best for her condition as a post-cancer survivor and also a diabetic. Now, some studies have found a link between diet, breast cancer, and osteoporosis, and as far as health is concerned, a well-balanced diet rich in vitamin and vitamin D Now, with Mrs. Mackenzie's case, we decided to go with the submaximal aerobic testing. Now, this is just because Mrs. Mackenzie does have a sedentary history and is not very active, so pushing her to her limits to obtain a VO2 result is not necessary at the moment. So we could provide a submaximal test, and that will be able to predict her VO2 from there. Now, the test will be conducted through a bicycle, and it just aims to give an accurate estimate of the aerobic fitness level, making it possible to compare the cardiovascular fitness of a particular age group. Now, the evidence behind this is that women with breast cancer who have undergone treatment have a significantly lower VO2 max than age-matched healthy women. So here we can see the results of Mrs. Mackenzie during her submax test. You could see how the test went on for 5 minutes, in which Mrs. Mackenzie was able to reach her heart rate, her 75% of her heart rate max, which was 152 beats per minute, and we managed to terminate the test once she had reached that towards the end of the 5th minute. Now, over here we could see the clinical data presented by Dawson in 2012, in which he ran a study and conducted a cyclogometer submaximal testing for post-surgery of breast cancer clients. And we could see at the top how Mrs. Mackenzie does have a much lower VO2 Over here we could see the goals that Mrs. Mackenzie had outlined. Now she did want to accelerate the time taken to reach 75% of her age in relation to the predicted heart rate. Moving on to muscular strength, that would also lead to increasing her predicted VO2 max and their leg, and she would also like to increase her fitness in order to delay fatigue, as she didn't feel that the 1RM a little bit towards the end of the sub-max test to cater for Mrs. Mackenzie's osteoporosis. So the 10RM was what we went with. Now, in a study conducted by Atkinson in 2010, mentions how he used a 10RM based scale for muscular strength, and he reported that the improvements in fatigue levels and quality of life suggest that the benefits of an exercise program extend beyond just physical fitness for cancer patients. Now, Mrs. Mackenzie did outline that one of her goals was to decrease the onset of osteoporosis and basically get into shape by building some muscle and gaining some strength just for her daily activities. So one upper limb, one lower limb Over here we could see the data for strength testing of Mrs. Mackenzie, in which she performed the machine-loaded chest press and the machine-loaded leg press. Now, for the machine-loaded chest press, Mrs. Mackenzie was able to get a 10 RM of 18 kilos, and that's a predicted of 24 kilos for 1 RM. And for the machine-loaded leg press, she was able to manage a 10 RM of 30 kilos, and that's a predicted 1 RM of 40 kilos. Now, the estimation formula we used was Bayesian, and that's how we got our values. Now over here we can see the clinical data that looks at the 1 RM bench press and the 1 RM leg press. Now from Mrs. Mackenzie's performance on the 10 RM and the predicted 1 RM, she does rate considerably lower compared to the participants in this study. Now it must be noted, however, that Mrs. Mackenzie did have a sedentary lifestyle and was not used to performing any weight exercises, so that might be a reason why she did perform much lower, but also just due to her osteoporosis that may have been a contributing factor. Now, it must be noted, however, that in this study we could see that the weight performed in pounds, while with Mrs. Mackenzie we did use the kilo. Now moving on to range of motion. Following breast cancer treatment, women will demonstrate upper extremity physical impairment, and these impairments will contribute to limitations in activities requiring use of the affected upper limb. Now, in a study addressed by Betty in 2010, there were limitations placed on a person's upper body range of motion following surgery on breast cancer, and this was evident with or without lymphedema. Now, Mrs. Mackenzie has self-reported a certain limitation in her movement capacities in her upper limb. However, this may also be due to osteoporosis. Now moving on to the data that was collected when using a goniometer when Mrs. Mackenzie was performing these measures. Now, as you could see, the affected limb just has a lower degrees of range of motion conducted by Betty to the non-affected limb, and in specific, the comparison of differences in the upper extremity measures for women with and without external rotation. So for Mrs. Mackenzie's case, we are looking at differences in lymphedema, and that could be section due to her, and you could tell that there are similarities right side with these patients, as they also had a big difference in the affected and non-affected limbs, and in specific with their shoulder abduction range of motion, as well as the elbow flexion and the shoulder internal and external range of motion. Now over here we could see the goals that Mrs. Mackenzie had set for her range of motion, and basically she states how she would like to increase her range of motion of the affected limb as close as possible to the unaffected limb. So the exercise physiologist did monitor her exercises and did measure them using a goniometer. Now moving on to the exercise program. So the exercise program is planned to span out for 8 weeks, and it focuses on exercises involving resistance training and cardiovascular exercises, as well as some range of motion exercises. Now Betty in 2010 outlined in her study that there is a great need for strength training, as well as aerobic training, and especially training for range of motion exercises, just to help with post-surgery. Now, studies of Dawson in 2010 and also Betty in 2010, they have outlined the need to train clients at a heart rate reserve of 50 to 75% while training them at a strength of 50 to 80%. Now, in the case of Mrs. Mackenzie, it is crucial that she does not progress to lifting heavy weights for a period of time just to cater for her osteoporosis condition. Now, the practitioner must also be aware that Mrs. Mackenzie is diabetic, so we do need to take precautions when she's training. So we need to make sure that she's always hydrated, always checking her blood glucose levels, whether it's pre, during, or post training, and just to make sure that she's taking her insulin and that there are sugar lollies nearby in case of need, just to avoid any hyperglycemia. Now to discuss the exercise program in a bit more detail. So the first 2 weeks, Mrs. Mackenzie will conduct a clinical aerobic component in which she will use a treadmill or cycle ergometer for 15 minutes at a heart rate reserve of 50 to 60%. Now her home-based exercise will consist of her walking to the shopping mall, which is about 20 to 30 minutes away, and she can do that 3 times a week. Now for the resistance component, the clinical part will consist of her using some machine weights and some dumbbells, and she will be performing some compound exercises just to target those larger muscle groups. A few examples of the exercises she will be performing is shoulder press, leg press, and chest press. Now for the home-based exercise, it is recommended for her to use a TheraBand, which is light in intensity, and it's the orange colored one. And we basically would like for her to incorporate some unilateral work just to improve her balance and to help strengthen her affected limb. So unilateral chest flies and shoulder flexions will help her greatly. Now it is recommended that she will be performing 50 to 60% of her 1 RM for machine weights, while the resistance band will just be light in intensity. Now she can perform resistance exercises once or twice a week for the clinical component, and she can perform the TheraBand work every second day. Now for range of motion, she could also use a TheraBand just to complete some lateral chest flies and shoulder flexion, as well as internal and external rotation, and this will be 3 sets of 12 reps. It is also advised that she performs some foam rolling just to release some tension from her upper and lower body. Now in weeks 3 to 4, it's pretty much the same thing. However, the heart rate reserve has increased a little bit, and also her clinical component for her aerobic work has increased by 5 minutes. She can now walk 3 to 4 times a week, and we have also advised that she use a Swiss ball to perform some crunches just to incorporate some core work, as there are studies that do prove that core work do help with the larger muscle groups in the resistance component. Now for machine weights and dumbbells, she will be performing the same exercises and movements. However, now she's moving on to 3 sets of 12 at 60 to 65% of her 1 RM. For the TheraBand, she'll stick to the light intense orange TheraBand just for her to get the movements correct and get used to it. Now for the range of motion, also she will be incorporating some incline, some flat, and some decline flies now, and also extension and internal external rotation of the shoulder at 3 sets of 12, and she will continue foam rolling to release some tension. Now moving on to weeks 5 and 6, Mrs. Mackenzie is working at a heart rate reserve of 60 to 65%, in which she's walking to 20 to 25 minutes a day, and also 20 to 25 minutes on the cycle ergometer or treadmill. Now there is interval walking when she's walking to the shopping centre, and this incorporates her walking at a fast pace for 30 seconds and then a slow pace for 1 minute, and repeating that till she gets there. We have also incorporated an interval circuit style where 3 stations will be set up, and they will incorporate her just performing bodyweight exercises such as sit to stand, star jumps, and static lunges, as well as her Swiss ball crunches, and this can be completed twice a week with 2 rounds. Now for the resistance base, she's still using her machine weights and dumbbells with her compound work. However, for her TheraBand, she's now using the moderate intense TheraBand. Now she's also performing 60 to 65% of her 1RM for machine weights, and she can perform this at least twice a week. For her home-based range of motion, she can use light dumbbells for her exercises, and with her TheraBand work, she could also complete the repetition range or just use static holds of 20 to 30 seconds. Now weeks 7 to 8, she's now performing at 65% of her heart rate reserve 3 to 4 times a week. However, we have introduced a high intensity interval session which incorporates just 1 session of 10 minutes a week. So she will also be completing those 4 stations now of bodyweight exercises, and those incorporate 20 repetitions of sit to stand, star jumps, static lunges, as well as Swiss ball crunches. Now these will be completed of 3 rounds per session, 2 to 3 times a week. Now for the resistance base exercise, Mrs. Mackenzie can be going up to 70% of her 1RM for machine weights, and this can be conducted at least twice a week with sets of up to 12 repetitions. Now for her home-based range of motion, she could also use her dumbbells or her TheraBand with her static holds of 20 to 30 seconds, 2 to 3 times a day. She will also be continuously foam rolling her upper body.